Hi Vikas, I am Mohit Yadav. I am going to take your examination of mouth, nose and neck.
Yes.
Palpating the anterior and inferior parts of nose for asymmetry and deformities. Now asking the patient for breathe in by pressing one each LNA. Signing a light into vestibule for the view of nasal vestibule. Note the color and condition of mucosa that covers the nasal septum. Conclude the examination by palpating the sinus frontal and maxillary sinus. Wearing gloves, inspect the outer surface of lips for symmetry of color. Not any lumps or ulcers present. With the good light and tongue blade, inspect the oral mucosa for color and ulcers.
Now give me a big
Note the movement of the soft palate and uvula. If the patient tongue obstructs your view, use tongue plate to depress it.
Now I inspect your teeth.
Check the teeth are loose will lead to risk of aspiration. Look for redness, exudates or ulceration. Using a gauze square, grasp the tip of the tongue and gentle pull it to patient's left to inspect the under surface. Inspecting the neck, inspect the symmetry while standing front of the patient. Not any mass or scars. Look for enlargement of parotoid or submandibular glands and not any lymph nodes. Palpate lymph node by using pads of the index and middle finger. Feel for preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical nodes. Now inspect and palpate for deviation. Place your finger on one side and note the space. Ask the patient to sip some water and observe for upward movement of thyroid gland. Confirm your visual observation by palpating the thyroid gland and firstly locate the isthmus. By standing back of the patient, put your fingers on neck and inspect the isthmus rising under your fingers. Note the size and shape of the thyroid gland. If thyroid gland is enlarged, listen to lateral lobe through stethoscope.